U.S. health insurance terms can be so confusing. Do you want to know the difference between an individual versus a family deductible? What about the difference between an individual versus family out-of-pocket maximum? Well, you're in the right place, and I'll simplify it for you in just 5 minutes. I'm Jules, the founder of Medical Bill Academy. As my husband and newborn faced life-threatening issues in my early 20s, our medical bills piled up. I dug into each bill carefully, and after finding ways to save thousands of dollars on my own medical expenses, I started helping my friends and family do the same. Now I'm helping you. Have you given up on saving time and money on your healthcare expenses? I hope not, because you don't have to untangle this crazy system alone. Make sure to subscribe to this channel so you can maximize your savings when new videos release. One of the most common questions I get is, what's the difference between an individual and a family deductible? Well, in around 5 minutes, you're going to walk away with that answer. And also understand the difference between an individual and family out-of-pocket maximum, because they work in very similar ways. This video is for individuals who are on a family health insurance plan, aka there's more than one person enrolled on the health insurance plan. If you are the only person on your health insurance plan, the individual and out-of-pocket maximum apply, but the family amounts won't really be applicable to you. Keep in mind that the examples I give today are very generic examples, so please always refer to your own health insurance plan if you have questions about your deductibles and out-of-pocket maximum. Also, remember that services that apply to your deductibles and out-of-pocket maximums must always be covered by the plan. If your plan doesn't cover massages, for example, then this cost won't count towards your deductible and out-of-pocket costs. All right, let's dive in. First, let's look at what an individual deductible is. This is the amount a single person on a health plan must pay for covered services before insurance starts to pay a portion of these costs. For example, let's just say it's January 2nd and Judy visits her in-network provider for a sick visit. Her health insurance plan is a $500 deductible, and she's paid $0 towards that deductible. If the provider bills $300 for that sick visit, Judy will owe $300 to the provider, and her insurance company will pay $0 since Judy has not met her deductible yet. Remember that each person on a family plan has to meet their individual deductible unless the family deductible has already been met. Let's look at the family deductible next. This is the amount a family must pay for covered services before insurance starts to share in the cost. If one or more of the individuals on the plan have met the family deductible, the individual deductible does not have to be met anymore. For example, let's say it's March 5th and Judy visits her in-network provider for an ER visit. Her health insurance plan has a $500 individual and $1,500 family deductible. Judy has paid $0 towards her individual deductible, but since Judy's son had an expensive visit to the ER in January, his claims from his ER visit met the family's $1,500 deductible. This means Judy has met the deductible even though she did not meet her own individual deductible. Is it starting to make a lot more sense now? If you aren't confident with all the health insurance lingo, I created a free training that will help you learn even more of these terms and confidently save on your medical bills. Click the link in this video's description and register for the 3 secrets to confidently save on medical bills training. Next, let's look at what an individual out-of-pocket maximum is. This is the maximum amount a single person on a health plan must pay before insurance starts to pay 100% of the cost. For example, it's September 1st and Judy has already met her $500 deductible and $2,000 in charges made up of her copays and coinsurance. So she's met her out-of-pocket maximum. She gets billed $0 for her in-network procedure because she's already met her individual out-of-pocket maximum. As you can probably guess, the family out-of-pocket maximum is similar to the family deductible in that one or more of the individuals can meet the family out-of-pocket maximum in order for it to apply to the entire family. A family out-of-pocket max is the most a family will pay for covered services in a health plan year before insurance starts to cover 100%. Once the family meets their out-of-pocket max, the individual's out-of-pocket max do not have to be met. For example, it's September 1st and Judy has paid $0 towards her individual deductible. Her son had a significant health issue this year, and they paid $4,500 in charges subject to their health plan, which meets their family out-of-pocket maximum. She gets billed $0 for that in-network procedure she has coming up because the family's already met their family out-of-pocket max. Remember that some plans may still charge copays after the out-of-pocket max has been met, so make sure you check your plan details. You now know the difference between an individual and family deductible. Way to go. You also know the difference between an individual and family out-of-pocket maximum. Want to keep learning practical strategies to save time and money on your medical bills with your health insurance? Hit the subscribe button and I'll see you in the next video.